I'll be there to make, okay?
Thank you. Thank you very much, Lise, and thank you very much to everybody for having me today. Kind of feels that way, doesn't it? I know it feels that way if you're a Minister of Finance in this country. The fact of the matter is that healthcare makes up a larger percentage of our provincial budgets than any other function. And its size alone makes it important, and that's why we need to have discussion, and that's why I'm here today. Thank you very much for having me. Thank you very much to the organizers of this great and important event. My name is Dan Lyons. I'm a Canadian citizen. I'm a principal with Oliver Wyman's Healthcare and Life Sciences practice, and I work in the Toronto office. I consider myself extremely fortunate that in my career I get to spend my days working with some of the largest organizations in the world to tackle what I think is one of the most pressing challenges facing societies today, and that's the healthcare affordability crisis. So I'm going to start with some bad news and some good news, okay? The bad news is that with healthcare on the trajectory that it's on, the system is completely unsustainable. This is no different than you or me, where we live. If my expenses go up year over year over year, faster, then my income goes up year over year over year, I'll reach a tipping point. And I'll tell you, that tipping point is not good. So the good news that I promised is that there are proven solutions to the healthcare affordability crisis. And I'm not going to talk to you about cuts. I want to talk to you about transforming the system. And I want you to think about doing it in a way that doesn't compromise on our four-pillar promise to the citizens of this great province: accessible healthcare, uncompromised quality, continuity and coordination, and equitable and ethical distribution. So before you go solving a problem, you have to ask yourself, do we have a problem? So I put this chart up, not to make us feel good, but I wanted to call out that the United States on any metric is disproportionate in terms of how much they spend per capita. They have a problem. And what that crisis is leading to is innovation. It's taking place, and they haven't solved their problems yet, but it's coming. And there are models that we're going to talk about today that represent proven solutions. They haven't been diffused yet. Canada, now we're sitting in that cozy middle, so we're surrounded by countries that sound comfortable, like the Netherlands and Switzerland, so we're good, right? Well, maybe that's not the case. Our spending goes up year over year over year. We spend 5% more on healthcare every year. In Quebec, we think that number is closer to 6%. At the same time, the working population declines year over year over year as a function of demographics. And as a result, we divert more and more of our provincial expenditures to healthcare, diverting them away from other critical social programs and infrastructure investments. You know, this is some simple math. So we started today with how much your provincial tax income exceeds your healthcare expenditures. It's in the positive. But if you forecast out the current trend of cost growth and income growth, over time, that buffer erodes. And we think in Quebec, the situation is particularly acute. We forecast that by 2038, Quebec revenues will fall short of healthcare expenses, and that's not good. So that's what we talk about when we say unsustainable. And at the same time, we continue to plow more and more money into a system that few are satisfied with. There's issues with health system needs. It's difficult to find the best treatment options. It's difficult to make better healthcare decisions. The system doesn't empower people to be healthier. And it's tough to have a clear path for how to improve your health. It leaves people powerless. We plump more and more money into a system that's dysfunctional. And so we have an affordability problem, and we have a satisfaction problem. And what that means is that it requires new thinking or a new approach. And to change the system, you need to think about changing healthcare financing and consumption, so that's the demand side, and healthcare delivery, that's the supply side. But to do that, again, we're not talking about cuts, we're talking about transitioning from old thinking to new. So can it get better? Since I was invited here for the Ideas Forum, I thought I would share with you an idea. And that idea is that Quebec should take the models of healthcare that are proven to tackle the affordability challenge and use them. Simple, right? At Oliver Wyman, we talk about the innovation diffusion gap, and what that means is that we think innovation is far out in front, and we have proven models that we're going to talk about today. The problem is that these models are not diffused broadly, so if they were used everywhere, we wouldn't have an affordability crisis. We know that there are models for health systems and governments that deliver higher value, high quality care, and don't compromise on the 4-pillar promise. And there's a whole world of proven technological innovators and startups that are hungry to power the next generation of models. So when you add up the innovation potential in healthcare, we think that healthcare represents the single largest public policy opportunity of the next decade. But it requires using the innovations that are there. So what is possible? Well, we know that models can save 20% cost overall. We know that there are models that would take our medical trend in Quebec from 6% inflation year over year to 1%. And we do it by improving our citizens' satisfaction and enjoyment of the system by 40%. That's what we believe is possible. At Oliver Wyman, we have what we call a transformational roadmap from 2010 to 2025. And it's charted through 3 waves. And the wave I'm going to talk to you about today is wave 1, and that's where we are today. It's the start line. It's patient-centered care. Wave 2 builds upon wave 1, and that's the world that Apple entered this week with their smartwatch and their Apple Health Kit platform. It's the world of mobile apps, social media, crowdsourcing, consumer gadgets, personal dashboards, quantified self, incentives and rewards. It's engagement. It's the wave that empowers people to live a healthier life. That's wave 2, but it builds on wave 1. And wave 3, this is the science of prevention. This is the wave that it's far out on the horizon and we don't exactly know what it's going to look like yet, but it's powered by innovations that are seeing the sequencing of the human genome go from $20,000 to $100 and performed in a lab setting versus a home or retail setting. It's going to allow us to be much more predictive and preventative and ultimately lead to cures, and that's on the horizon. But I want to pull you back to the start line, and that's wave 1, patient-centered care. Make no doubt about it, healthcare is complex, and as it shows up to patients, it's extremely complex. And you or myself, if you have a loved one who have experienced the system, you know how this feels. It's complex, it's fragmented, it's isolating. And make no mistake, this is not because of the people in the system. We have the most talented, most gifted, most caring individuals in the world working in our hospitals and our clinics. The problem is that the system isn't organized in a manner to unlock the inherent potential in our people and deliver healthcare the way it should be delivered. So I want to talk to you about changing the frame with patient-centered care. There's a couple tenets of this. Number 1, with patient-centered care, we move from a physician-centric model to a team-centric model. So instead of just a physician, you get a physician, a pharmacist, a nutritionist, a navigator, behavioral health provider. The team becomes accountable for your healthcare longitudinally over time and becomes your health and well-being partner. And it's focused on coordination, holistic health and well-being, and prevention, not sick care. And this world feels entirely different. We go from health volume to health value. That's how you tackle the affordability crisis. So these care models, and I'm going to show you 2 examples today, they all have a common tenet, and as Quebec, what I would hope starts to think about as you transform the system, these models have 3 core pillars, and you can think about these as 3 legs of a stool. So if you do one without the others, or you do 2 without the other one, you don't get the impact that you would be hoping for. So the first is changing the care model, the clinical model. This is how our practitioners interact with each other and interact with the patient. The next is the financial incentives, shifting the paradigm from fee-for-service to fee-for-value. and ensuring that the system wins when our citizens win. And the last is technological empowerment, not just digitizing the old system of healthcare, but empowering the new system. So remember that stool. So we know the one-size-fits-all approach of healthcare just doesn't work. It's one-size-fits-none. And the secret to population health management is what we call the population health pyramid. And so what you have in front of you is a schematic, and what it shows is that at the top of the pyramid you have very, very few people who are very, very sick. There are frail elders, there are grandparents, there are polychronic neighbors. They're 5% of the population that makes up 45% of total healthcare expenditure. And the model that you would apply to help them looks entirely different than the model that you would apply to help somebody at the bottom. In the middle of the pyramid, we have our chronics and our at-risk individuals. And these models focus on coaching, monitoring, and support. And the goal is to make it so that they don't progress from the middle of the pyramid to the top of the pyramid. That's where savings come from. And then, of course, you can generate significant savings at the top of the pyramid to fund initiatives for the bottom of the pyramid, for the healthy, like nutrition programs and healthy communities. It's population health economics, trickling down from the largest opportunity at the top to the bottom. And then just quickly across the different models, each has a different savings profile, but we know with the high intensity, polychronic frail elder model, savings are proven to be in the 16 to 24% range. So when I talk about solutions that are proven, that's what I'm talking about. So Lee's mentioned at the start that I'm a former director of Oliver Wyman's Healthcare Innovation Center. The Innovation Center is a collaboration of close to 50 healthcare CEOs and senior leaders. And the purpose of the program, we bring together these leaders from healthcare, retail, social media, technology, to collaborate on the new models of healthcare that we think have the potential to reset the trajectory of the industry. There's a couple examples of who we work with at the bottom and participate in our community. Today I'd like to show you two examples of the proven models that I talked about to give you a feel for what this new world looks like and what's possible. And because I can't tell their story as good as they can, I'll let you listen to them.
I'm Liba Lesson. I'm the president of CareMore. The CareMore model is really based on three premises. One is that to the degree that patients understand their disease, understand all of the things going on in their body, the more they understand, the higher the probability that they'll have a good outcome. The second premise is that in an average daily primary care practice, where a primary care physician has 5 to 10, maybe 15 minutes to spend with a patient, it's absolutely impossible for all of the things that I just described to happen. Thirdly, it's very important to recognize that healthcare in general is the sum total of clinical care, behavioral care, social support at home, patient education, nutritional care, and so forth. In the Medicare population, 15% of Medicare beneficiaries consume 75% of Medicare costs. We think that actually the trick to reducing that number dramatically is actually to apply a lot more resources to the other 85% who are aging and emerging into chronic conditions, keeping those patients stable, avoiding the big catastrophic events that happen in that big 15% swing. And that is the trick, in our opinion, to saving the Medicare system.
You know, CareMore is a fantastic story. So they started 20 years ago in Southern California. They have standalone health and well-being clinics. They're focused on the Medicare population. So these are our seniors. They're 65 plus, and their models of blending individualized care, remote monitoring, ancillary services. They coordinate care management, disease management, and they provide home care, hospice care, and palliative care. And they're the first point of contact for all their members. The stories from CareMore are so many in terms of what they do for their patients. Every visit at CareMore, they'll clip the patient's toenails so that they don't trip and fall in the home. They'll visit the patients in the home, and if they have shag carpeting, they'll take out the carpeting and put in new carpeting, again, to prevent slips and falls. For patients that don't have an air conditioner, they'll put in an air conditioner so that you don't end up in the ER on a hot day. But that feels different than today. They have care teams that align around a single vision. They're empowered by technology, and they provide much, much more in the benefit stack than you would in a standard Medicare Advantage plan. And they do it all at a lower cost. We said that CareMore's average patient costs are 18% lower than the standard Medicare population. And they do that through reduced hospitalizations, reduction in stroke for hypertensive patients, and lower hospitalizations. Higher quality, lower cost. The next example I want to show you is from another one of the innovators in our community. It's from Iora Health. It's a slightly newer model, but it's scaling rapidly across the United States. I'd like you to hear from Dr. Ruchika Fernandopoulos. He's co-founder and CEO of Iora Health.
Satisfaction actually declined, and they didn't show any impact on quality or cost, right? So why is that? I think it's because we have just such a big problem. And the analogy I use is, imagine we're sitting, in Boston, which is where I'm from, and we have to get to London, and we have to get there in a day, right? But all we have are boats, like the Normandy up here, right? And a boat takes a week. Say it's 1902, right? No matter how much we streamline the hull of the boat, we study the tides, we put a faster engine on the boat, right? Make incremental changes, we're never going to get there in a day, right? We can call the boat builders together for a conference, by the way. That won't fix the problem. What do we need? And the obvious answer is we need an airplane, right? And the way we build airplanes is not by putting wings on boats. The way we build airplanes is we build airplanes. And so that's sort of what we've set out to do, is why don't we start from scratch in any other industry? If the incumbents were doing such a bad job, no offense, there would be new entrants to come in and said, let's start from scratch, break what you all think are the rules. You have to get paid free for service, your doctors have to do everything, but they're not really rules. Just like it's not a rule you have to go by water, and we can break the rules, and let's actually show how it's done.
I love that sentence, planes, not boats. So you'll notice some common themes across these models, and these are the themes that we think could be adapted into the Quebec healthcare system. They help patients better manage their health. There's navigation. There's no financial barriers to care. A primary care doctor and a care team are assigned to each individual, and they take a personalized approach to holistic needs longitudinally over time. So a lot of things similar to the model like CareMore in terms of the incentives, the culture, and the care delivery. And then I know you're going to say to me, well, Dan, actually, weren't we supposed to talk about taking out cost? This all sounds expensive. And actually, here's the secret of population health management. So on the left-hand side, you have the total cost stack. That's everything that we spend on the population in terms of their health care. And that small blue bar at the bottom is primary care. And the light blue bar at the top, that's much needed hospitalizations, specialist care, pharmaceuticals, and devices. Also in that light blue bar is waste, missed opportunity due to uncoordinated care, rehospitalizations, and unnecessary ER utilization. And so what Dr. Ruchika says is let's double the size of the primary care front end. But at the same time, remove all of that stuff we talked about in the blue bar, and net you end up with cost savings. And right now, their model's at 11%, although Dr. Ruchika will tell you he's just getting started. They've shown that quality of life and cost savings can go hand in hand, and that's why when I say we're not talking about cuts, we're talking about transformation. That's why it's so important. So what should Quebec do? Like we talked about in the transformational roadmap, we're on the starting line. We know that there are organizations around the world that have been tasked with piloting population health management and coordinated care. Again, I hesitate to use an American example because they certainly don't have everything figured out, but the Centers for Medicare and Medicaid Studies, in their Medicare program, they're responsible for the seniors 65 plus. And they've piloted hundreds of accountable care initiatives and primary care transformation efforts. How can Quebec do the same thing? We have all the pieces. So we have the health system. We have the retail convenient care access points. We have behavioral health system. And we have a whole world of innovators dying to empower the next generation of models. How do we bring them together in a model that works for people? And we talk about technological empowerment. We don't want to digitize the old system, although that's an important first step. We want to empower the new systems. And new systems and technologies are allowing providers and systems to collaborate together in ways that were never possible before. Empowering the new, not digitizing the old. And this is an important point, and this is a uniquely Canadian situation. And I'll just make one quick point. With the American system, folks bounce between funding sources. And so if I make an investment in a person today to stop smoking, if they don't get cancer 10 years from now, I don't accrue the benefit. In Canada, you're going to be with people throughout their entire lives. I was born in a Canadian hospital, and I will die in a Canadian hospital. And so to take a longer-term perspective on population health and people's trajectory is the name of the game. Take a long-term view, and don't stay focused on the here and now. So some concluding thoughts in 1 minute. Anybody in an insider position in this industry is going to tell you that more than a third of healthcare dollars are wasted today. The innovators are going to tell you that they're just getting started, and we want to put you on the starting line as well. Because of the innovation that we see, we think healthcare has more opportunity than any other industry in the world, including technology. And because of the importance it plays in all of our lives, I ask you, is there anything more important? With that, I'll turn it over to you, Lise. Thank you very much for your time. Appreciate it. Thank you very much.